Hi, I'm Maggie Byers, and I'll be presenting on Chapter 28 about fetal development and pregnancy. So, in the beginning, about the first 2 to 3 weeks of pregnancy, you'll see the development of the amnion, the yolk sac, the allantois, and the chorion. And the amnion, which is in blue in the picture, is the fetal membrane, and it surrounds the embryo, and it is also filled with amniotic fluid. The yolk sac is an extra embryonic membrane, and it can be seen in green. This aids in early blood cell formation. The allantois, which is in yellow, is the embryonic membrane, and this develops into blood vessels it develops its blood vessels into the umbilical cord. The chorion, which is in red, is another extra embryonic membrane, and this forms the fetal part of the placenta. So around the 4th week, we see germ layer formation. There are 3 different germ layers: the ectoderm, the endoderm, and the mesoderm. The ectoderm, which can be seen in blue, is the nervous system and skin, while the endoderm, seen in yellow, is the epithelial linings of the digestive system, respiratory, and urogenital systems, and the mesoderm will form the rest of the parts, and the mesoderm is in red in the diagram. By the 4th week, the heart will be pumping blood, and a small limb buds will begin to appear, and the body will be in a curved C shape. Gastrulation sets the basic structure for the embryo and its cellular arrangements, leading to organ development. This process is preceded by organogenesis, and this is the phase where organs and organ systems begin to form. So around the 8th week, organogenesis will be nearly complete, and many physical changes will occur. As we can see in the picture, the head will be nearly twice the size as the body, and limbs are beginning to form. Fingers and toes have appeared, and they are initially webbed, but by the 8th week, they are separated. You'll also see elbows, knees, wrists, and ankles are present, and they can bend. Limbs make small, spontaneous movements, and muscle contractions can occur. The bones will begin the process of ossification, and this is when the bones harden from the cartilage to the bone. So around week 9, the fetal period begins, and this makes the baby officially a fetus. This is when many of the body systems mature and many notable changes occur, like facial features that are developed, and the eyes face the front rather than the sides, and eyelids are fully formed. The skin, dermis, and epidermis are apparent. The liver starts making red blood cells and bile is secreted. The kidney starts producing urine, and the urine is sent into the amniotic fluid. The lungs can inhale and exhale the amniotic fluid, and the sex can finally be determined. By the end of month 3, the risk of birth defects has lessened, and most essential structures are in place. So for the 4th month, or weeks 13 through 16, this is the start of the 2nd trimester. And you can see in the left part of the picture on 15 weeks, the length has grown significantly. The head becomes more proportional to the body. The chin, lips, and nose are visible and defined. And you can't see in the picture, but the eyelid is still closed, but the retina is formed. In the 5th month, this is when the period called quickening begins, and this is where the mother can feel the fetal movements. And some prominent features that occur during this 5th month include the vernix caseosa, which is where a waxy white coating on the skin forms, and the lanugo is a soft hair, and this covers the entire body, and it starts to form. And the final thing that you might be able to see in the picture is the ears are in their final position, and they can start to detect sound. So in 21 to 30 weeks, or months 6 and 7, the fetus begins to develop the systems that it needs to survive outside the womb, like the lungs, brain, and others. And some prominent developments that happen is the movements. The fetus can respond to touch and sound, and facial features like eyelashes, eyebrows, and hair are visible. and the eyelids should open around weeks 26 through 28. The testes descend to the scrotum in males, and fingernails and toenails are completely formed. For months 8 and 9, this is the third trimester, and this is where survival outside the womb is likely and the final changes are made to the fetus. These changes can be seen as an increase in fat in the hypodermis, and it help regulate body temperature. And the skin will also be thicker and less translucent, and organs are almost fully developed. Some anatomical changes you will see during the pregnancy are the reproductive organs will become more vascular, and this causes the vagina to be a purplish hue, and the breasts also enlarge and darken due to rising estrogen and the progesterone levels. The uterus grows significantly, rising into the abdominal cavity and pushes against the diaphragm, and this causes rib flaring and thoracic widening. The center of gravity will shift, and it often causes back pain and lordosis. The hormone relaxin loosens pelvic joints, and this eases childbirth but causes a waddling gait. The average weight gain for a pregnant woman is around 28 pounds, and this can be influenced by fetal growth, placental mass, blood volume, and enlarged reproductive structures. Things like folic acid, iron, calcium, and protein are essential for fetal development. Some metabolic changes during pregnancy we see is the placenta will release hormones to support fetal growth. Placental growth hormone increases fat breakdown and glucose production to help fuel the fetus. The human placental lactogen, or HPL, shifts the maternal metabolism from glucose to fat, and this helps prepare breasts for lactation. However, it can reduce insulin sensitivity and lead to gestational diabetes in some cases. CRH and cortisol levels tend to rise toward the end of pregnancy, and this aids for maternal stress adaptation, and it helps mature fetal lungs. Vitamin D levels increase, and this boosts calcium absorption, even with high parathyroid hormone levels, ensuring fetal bone development. Physiological changes during pregnancy. In the digestive system, hormones can cause nausea, heartburn, and constipation as the uterus compresses digestive organs and slows motility. The urinary system handles increased blood flow and fetal waste, causing more urine production and frequent urination due to the compression of the bladder. Respiratory changes we will see include increased tidal volume and occasional breathing difficulty or dyspnea from the diaphragm and displaced and hormonal effects. Cardiovascular changes include up to a 40% increase in blood volume, higher cardiac output, and pressure on pelvic veins, which can cause varicose veins and leg swelling. Fetal cells may enter maternal tissues. The long-term effects of this are unknown, but it could influence immune responses or disease resistance.